Hello, welcome to the Psychology of Dating podcast. My name is Nadine Newkirk. I'm both a clinical psychologist and a dating coach. For today's podcast episode, I'm going to give you information on what is EMDR therapy and how might it be helpful to process past difficult memories and experiences to help you actually move forward in your dating. Maybe you've got some memories in the past, whether it's from childhood or whether it's from past relationships, and every time you think about it, it brings a lot of distress, and these circumstances, these memories might actually be holding you back from moving forwards in the new dating experiences, although they're different. Before we jump into the podcast episode, I'd like to remind you that I've got a free guide called Top 3 Mindset Shifts in Dating. You can find the link to that in the episode show notes. Okay, so I want to talk to you about EMDR therapy, which stands for Eye Movement Desensitization and Reprocessing. Quite a mouthful. And I recently did a first level training in this, where it was 3 days, full days at the beginning of the year, and then 3 full days towards the end of the year. So it was quite intensive, and we witnessed live practicing of the therapy, saw videos of it, and also did demonstrations with each other, practiced, and then also, I've seen clients through processing. There's these 8 phases that you take someone through. And it made me think about how this therapy could be helpful to people when they're dating. When you're dating someone new in the present moment, it's right here and right now. However, both of you, the person you're dating and yourself, both bring baggage. I don't really like the word baggage because it has such negative connotations, but imagine you both have suitcases. You both have a bit of luggage with you. And those are suitcases from your past romantic relationships, friendships, work experiences, health, family, childhood upbringing. You've got a whole lot of luggage with you. And some of that luggage will be really beneficial. Like maybe you've had a lot of practice being assertive or knowing what you want at work, and you've been able to translate that skill to your dating life. Then that can be really useful. And also, some of this luggage is holding you back from moving forwards in dating. People could have traumatic or stressful upbringings, difficulties with their parents. Maybe in their family, they found it difficult to express themselves, express their emotions because they had a caregiver who was quite critical or angry if they did so. And now they find themselves trying to date and trying to speak up. And although they logically with their thinking brain know they want to do it, their body goes into panic and they freeze every time they try to express their emotions. And we all have these things that we find really easy in relationships and things that could be our kryptonites, things that are really diverting you from your goal in dating. Maybe you want to get a long-term relationship or things like that, and there's these blockages that are stopping you. And there's plenty of practical skills you can do in the present moment to help with that. However, sometimes we haven't processed or addressed how past relationships and events has really affected us and affected your nervous system and your thought patterns and all the things that go with it. And EMDR therapy is one of those therapies that can help you process these past memories, to kind of unstick them, and then to help you then be in the present moment and not have those past experiences dictating how you are now anymore. So how do you process these memories using EMDR therapy? You use what's called bilateral stimulation. This is where you might move your eyes from side to side. So the therapist will move their fingers from side to side and you'll watch it, or you might use a computer or something else to help you move your eyes from side to side rapidly. There can also be other bilateral stimulation, so it might be wearing headphones where you hear a noise from left to right, or tapping knees left to right. So there's some type of bilateral stimulation whilst you bring up a past traumatic or stressful memory. and you allow your brain to go through any memories, thoughts, images, anything that comes up in your mind. You allow your brain to process that whilst you are doing the bilateral stimulation. So, for example, someone has a fear of dogs and they have this first memory in year 1 when they were bitten by a dog. So they bring that memory up and they move their eyes rapidly from side to side, and they do certain sets, and then they pause. The therapist asks them what they've noticed. Then they begin the eye movements, let their brain think of whatever it needs to think of, and that process is repeated till the memory is no longer distressing. Someone can have a really stressful event. However, they might find when they bring that memory up, they feel calm in their body and it's no longer really impacting their present day life. And we can also have seemingly small but very impactful life events that whenever you bring it up, you feel a lot of anger, distress, grief, anxiety, whatever really intense, distressing emotions come up. Those are the types of memories that have a lot of activation in the body, and you feel that they're impacting your present day life. Those are the memories that you process. And why do we do the bilateral stimulation, like the rapid eye movement? The best way I can explain it is using this train analogy. So imagine you have a train, and this is your train of life. And the train is going along the tracks, and occasionally it'll stop at a different station. You might get off, have a little look around, but you always get back on the train and keep on moving. It keeps moving forwards. When you have a traumatic, really stressful life event, what happens is your brain gets overloaded with stress hormones, and the hippocampus, which is in charge of memories, gets flooded, and it can't process memories like it normally does. So normally the brain can file away a memory and say, that happened in the past, it's no longer in the present. But if you've had a traumatic, stressful event, the brain no longer does that, and it has that memory stored in present day, short-term memory. So each time you think of that memory, your body reacts as if it's happening in the present moment. If a person was afraid of dogs because they've been bitten, anytime they see even a harmless dog in the present day, their whole body will be acting as though they're in danger. And they might get fight, flight, freeze responses, anxiety, fear, want to run away, anger, anything to try and protect themselves. And that can happen in dating experiences too. Maybe you've had a lot of explosive arguments with a past partner. And now, anytime there's a slight bit of tension, even though it's pretty mild in the present moment with the new person you're with, your body gets really tense, or you get into this rage mode or lots of anxiety, and your emotions don't really match the situation because they're actually being triggered from the past. So with this train, it's getting stuck at certain stations and it's not being able to move forwards. And with EMDR therapy, you're keeping one foot in the present using the bilateral stimulation, so moving your eyes or tapping or listening to noises left to right ear, that keeps you in the present moment. So your brain can now remember you're here now, that's in the past, and you also have another foot in the past to get that train unstuck from the station and keep it moving forwards. And knowing now that that event happened in the past, your body no longer needs to react in that way. And what I love about EMDR therapy is it's a therapy that lets your brain do its natural healing. The premise behind it is that your brain is geared towards healing. Just like if you got a paper cut on your hand, your body would naturally start to heal itself. The skin would heal back over. And our brains, if we can give them the right circumstances, can do their own healing. So it's amazing the types of insights and helpful beliefs people come to after they've done this eye movement and let their brain do the natural processing. It's pretty incredible what I've seen. I'll give you one example of a memory I processed during the training when we practiced with our colleagues, and hopefully that'll help give you a bit of a better idea of what EMDR therapy might be like. So my memory was me in, I think it was kindergarten or year 1, and my friends were all playing in the playground. I can't remember what game we were playing, but I was feeling left out. I wasn't feeling very good that day. And I remember walking around the playground, feeling quite lonely and having these thoughts like, what is wrong with me? Why aren't I just fitting in and feeling happy just like all my other friends playing? And I had a memory of me standing outside the toilet blocks and I could see the school oval and I was having these thoughts, what's wrong with me? And that memory seems kind of small, but it got stuck in time. And every time I thought of that memory, I was actually bringing up an old belief of that little kindergarten year 1 Nadine. And I didn't realize that I had that stuck belief of what is wrong with me every time I thought of that memory. It never occurred to me to think anything differently. And as I was doing the eye movements and letting my brain come up with whatever it needed to think about and associations, my brain started to think about actually what was going on in my life during that time, what was the larger context. Maybe little Nadine was having some big feelings about things going on in her life, and it wasn't even related to that day playing with her friends. And a little kid doesn't have all the tools to manage their emotions or understand and know exactly what to do. And there was nothing wrong with her. Lots of other little kids can sometimes feel lonely or feel left out, but that's a common human theme and a feeling to have. And I also was able to bring more compassion to that little Nadine and unstick that belief, what's wrong with me, into, that's a normal human experience. That was a more helpful belief I had about myself. And it was incredible. The colleague that I did it with did not give me any of these insights, did not prompt any of this. This was just my own brain doing its natural healing at the time. So if you have some skeletons in your closet, so to speak, that you've been shoving away, trying to close the door, but you noticed it's really impacting you, the skeletons keep popping out at unexpected moments. Maybe you don't think about it at all, but you're kind of numb because you're not really addressing it. Or maybe you think about it a lot and you can't stop the impacts of rumination and going through it over and over in your head. Maybe EMDR therapy could be something to look into. Again, there's so many different types of therapy, so it's good to pick which one is right for you. But know that there is this therapy out there that helps people process traumatic memories and lets you move on with your life. You don't have to be stuck in those moments, that you can really move forward and help yourself in your dating experiences. Okay, everyone, have a lovely day or night wherever you are. I look forward to speaking with you all next week.